I'm here to see Jens. Great, thank you. Hi, so Valerie with Central Coast Now, and today we're at Santa Barbara Family Dentistry in Santa Maria, California, where we're going to be educated more about our teeth and preventative care, and I'm looking very forward to meeting Jens Gonzalez.
Hi, Valerie.
Hi, Jens. Very good to see you.
Good to see you,
How
too.
are you today?
Good, and you?
Great, great. Just telling the viewers how excited we are to bring them Santa Barbara Family Dentistry today. We're going to take a little bit of a tour, and we're also going to get some education from the doctors here, including Dr. Gonzalez. And tell me a little bit more about what you do for Santa Barbara Family Dentistry.
I do public relations and marketing over here in Santa Barbara Family Dentistry.
Okay.
And one of my main goals over here in this practice is to find out what the patient really needs and how we can improve our service to them.
Right, and I'm glad you brought that up actually, because one of the great things that Jens does is he conducted several surveys from many of their patients here over the past few months, and with that, that's what we've compiled in the show for you today. So we'll be addressing your specific needs as far as any input that you've given to Santa Barbara Family Dentistry, and I just think that that's quite amazing as far as any dentist office go along the Central Coast. So we're looking very forward to be educated, and I would love to meet Dr. Gonzalez.
Okay, let's go and meet him.
Great, thanks. So how long have you been here now?
I've been here for 3 years since I graduated from college, but
Okay.
I'll be around for like since Dr. Gonzalez started because he's my brother.
Oh, great. Okay.
Oh, here's Dr. Gonzalez.
And here you are. Hello.
Nice to meet
Very
you.
nice
I'm
to
gonna
meet
leave you
you.
with him.
Okay.
So,
Thank
have
you,
fun.
Jens. Very good. I'm sure we will.
Thank you.
So it's great to meet you. I've heard so many great things about Santa Barbara Family Dentistry, not only within the community itself, because I belong to many organizations, but just from friends and family. I mean, it just seems like you're throughout, the whole community. You hear your name talked about often, which is always a good thing in a positive way. And I know professionalism is really important, and being in a comfortable environment and just being here for a brief moment, it looks like you definitely provide that to your patients. So tell me a little bit more about the professionalism and the setup that you have here.
Well, first of all, I'm glad that you came, and thank you for coming. And well, this is our office. Our office is to serve the patient, and our goal is to have a healthy, happy, educated patient.
Well, as you were saying, you can definitely tell, based around looking around here, the level of equipment that you have available, the technology, it's unlike anything else I've seen in any other doctor's office.
We have 5 doctors
Okay.
that we, is Dr. Garzon, Dr. Garzon, my wife, Dr. Mujica, Dr. Lee, and Dr. Vendaño, and myself, that we try to cover all the areas of dentistry. We care about our patient, we love what we do,
Right.
and we try to serve them in the best way possible.
Absolutely.
It's been repeated again and again that prevention is better than cure. And that's what dental checkups are all about: prevention and early detection of dental problems. Many people think that there is no need to go for a dental checkup unless they are in pain. This is not true. Many dental problems progress very slowly without any signs. We are trained to detect such problems. Early detection and timely treatment can correct or even prevent problems from occurring. Apart from spotting trouble early, regular checkups can be valuable in many other ways. What happens in a dental checkup? First of all, we look carefully or examine all parts of your mouth and face. Teeth will be checked for such things as cracks, wear, decay, faulty fillings. Gums will be checked to see if they have a healthy color and shape. If they bleed, that is a sure sign of disease. Bones, cheeks, tongue, palate, and other parts of the mouth and face will be examined for any unusual swellings or surface changes. Will X-rays be taken? Yes, if we think they are needed. X-rays can be very helpful to detect hidden problems. And don't worry, dental X-rays are very safe. What else? The most important part of the checkup is the discussion that you and your dentist can have after the examination, the consultation. And this may include an explanation of what has been seen in your mouth, recommendations on how to treat any problems discovered, also preventative measures like fluoride application or fissure sealants, advice on diet and the correct ways to clean your teeth, counseling on how to overcome any destructive habits that you may have, monitoring the development of the teeth and jaws in growing children. Anything more? Yes, your expectations, needs, and importantly, any anxiety that you may have should be brought up so that we can understand you better. If you have any medical problems, its effect on your oral health and treatment will be explained. Dental checkups provide advice and guidance, early detection, timely treatment, all of which are valuable in maintaining healthy gums and teeth throughout your life. Initial consultation. Outstanding dental health for a lifetime, or finally having the beautiful smile of your dreams. Whatever your goals, our suggestions for your care are based upon sound principles and the highest standards of care that ensure you the best long-term results. Your initial appointment enables us to review your medical and dental history, discuss your treatment goals, and conduct a comprehensive dental examination. Once we gather all the essential information, we will share our findings and provide you with information and options to achieve your goals.
Tooth decay is caused by the action of bacteria on the foods you eat. Thousands of bacteria normally exist in your mouth, and most are beneficial. But some of them form tightly knit colonies called plaque, which is the sticky, colorless film that develops constantly on your teeth. The bacteria in plaque survive by digesting the foods you eat, specifically the ones that are broken down into simple sugars. This includes candy and sweets, as well as other high carbohydrate foods like pasta, bread, cereals, milk, dried fruits, juices, and sweetened drinks. When the plaque bacteria digest these sugars, a chemical reaction occurs, and the bacteria produce acid. The acid slowly dissolves the minerals in the outer enamel layer of your teeth, forming a demineralized area that appears as a white or brown spot. In the best circumstances, saliva balances the effects of the acid. It helps wash away bacteria, neutralizes the acids, and replaces the minerals that were lost to acid attack. However, if you eat too often or too many sugary or starchy foods, the saliva can't keep up with the bacteria, and they reproduce wildly, developing even thicker accumulations of plaque. These accumulations keep saliva away from the tooth surface, and eventually the acids create a hole in the enamel layer of your tooth. This hole in the tooth is called a cavity, and once decay has gotten through the hard enamel, it can grow much more quickly in the softer inner layers of the tooth. Areas in the mouth that trap plaque are especially at risk of decay. These include the grooves in the biting surfaces of teeth, in between teeth, at the gum line, and any exposed tooth roots. You can resist tooth decay by regularly taking action to slow acid production, remove plaque from your teeth, and strengthen the tooth enamel. Cut down on acid production by limiting the number of times you eat each day and reducing sugary and starchy foods and drinks in your diet. Brush after meals to remove plaque and floss at least once a day to get at the plaque trapped between teeth. Use a fluoride toothpaste because fluoride strengthens tooth enamel. When you can't brush, rinsing with water or mouthwash can help, and chewing sugarless gum will stimulate the saliva. Chewing gums that are sweetened with xylitol also inhibit decay-causing bacteria. Understanding the process of tooth decay and taking action to prevent it will help keep your teeth healthy for a lifetime.
This is our family.
They provide really friendly service, and it makes me feel like I'm part of a family. They treat me really well.
The level of patient customer service is excellent.
My appointments are always right on time, and say everyone really does a good job here.
Our family keeps growing. Thanks for being part of it. Santa Barbara Family Dentistry.
Talking about sodas and juices, that's one of the most dangerous things that you can eat or drink. But soda has acid on it and has a lot of sugar. What happens with sugar is that bacteria are able to create a lot of acid and problem with sugar. They grow faster in sugar. That's why sodas, juices, energy drinks are really dangerous for your teeth.
For many people, soft drinks are the beverage of choice. But if you drink them all day long, you may not realize the damage you can be doing to your teeth. The problem is twofold. First, soft drinks can contain 10 to 12 teaspoons of sugar per serving. So, when you drink, you're essentially bathing your teeth in liquid sugar. The bacteria that naturally live on your teeth feed on that sugar and produce acid. Without proper care, the acid will dissolve the surface of your tooth and create a cavity. The second problem is that soft drinks, especially diet sodas, contain acids. The acids wash over your teeth, affecting the entire tooth structure. In extreme cases, they can erode the protective enamel and expose the sensitive dentin layer inside your tooth. If the dentin is exposed, you may become sensitive to hot, cold, or sweet foods, and your teeth can appear yellow. As your teeth continue to get thinner, the edges can crumble and lose their natural shape. This is not just a problem for adults. Children and teens can have frequent access to soft drinks. Since their teeth are still forming, the damage to them can be great. Colas, sports drinks, energy drinks, vitamin waters, fruit juices, teas, blended coffee drinks, and wine all contain the sugars that can damage your teeth. Even diet colas contain destructive acids. Your best choices for a beverage are milk and, of course, fluoridated water. If you must drink soft drinks, use a straw. Don't drink for extended periods of time. Don't hold the liquid in your mouth before swallowing. Cut down on the amount you consume. After you drink, rinse your mouth with fluoridated water. And wait at least 20 minutes before brushing. With smarter choices and regular checkups, you can protect the health of your teeth for years to come.
Periodontal disease. Let's define what periodontal disease is. Periodontal disease. Disease is an infection. You see? Because if I tell you periodontal disease, you're going to be like, what?
Right, right.
Then I want for you to understand what is periodontal disease. Periodontal disease, disease is an infection. Perio is around and dental is teeth. This is an infection around your teeth.
Periodontal disease is the #1 reason adults lose teeth. That's because, as periodontal disease advances, the infection can destroy the ligaments and bone that support your teeth. If you have periodontal disease, your gums may bleed when you brush or floss, and they may be soft, swollen, or tender. You may have persistent bad breath. Your gums may also start to pull away from your teeth, and your teeth may become loose. The main cause of periodontal disease is the long-term buildup of plaque, the sticky, colorless film of food and bacteria that constantly forms on your teeth. It's hard to see plaque, but look at how it shows up after we've stained it with red dye. When plaque stays on your teeth for 2 or 3 days, it can harden into tartar. The bacteria and plaque invade the spaces between the teeth and gums and begin producing toxins. These toxins, combined with your body's reaction to them, destroy the bone around your teeth. And once lost, bone never comes back on its own. If there's not enough support for the teeth and they become loose, they might have to be removed. To determine if you have periodontal disease, we perform a thorough examination, which includes taking x-rays to determine how much bone has been lost. We measure the depth of the pockets with a probe. A reading of more than 3 millimeters could be a sign of periodontal disease, and we'll pay careful attention to those areas. If we find periodontal disease, we'll talk about treatment options and proper home care. We want to help you maintain the health of your teeth, gums, and bone, and restore your healthy smile.
Hi, so now I'm here with Dr. Garzon, and she's going to tell us a little bit more about what she specializes in here at Santa Barbara Family Dentistry. And as far as we know, professionalism is very important here. That's one of the things that we surveyed, along with educating the patients in regards to the process that it takes. So hopefully you can shed some light on how Santa Barbara Family Dentistry goes about that process.
Oh yes, actually we've been here working with the community for over 8 years, and the most important thing for us is educate the patients on their oral health. We first bring the patient, make sure we do a thorough, complete exam. We explain the patient everything, what's going on in their mouth. We give them some education on the first visit. We do the oral cancer screening, and then we have a complete appointment just for them and Dr. Gonzalez to go over all their treatment needs, everything that they need to know to better take better care of their oral health.
Okay, so there is an entire process, and they actually get to go and meet with Dr. Gonzalez before any treatment is done. And that I would imagine that as far as insurance and as far as payments and things like that, do you guys have programs and assistance that offer to, you know, different patient situations?
Yes, we do.
Okay.
We in that appointment we try to handle everything that is first ideal treatment and all the options that the patient might have. In that appointment, we set up payment plans through different financial companies like Care Credit that might help on situations where patients might not have the money right away to pay for their dental services.
Perfect, and that's always helpful, of course. I'm sure we've all been in a situation, I know I have, where you know, something happens or you want your teeth fixed and you want them to look great, but yet you might be in a financial situation at that time, so it's good to know that you guys actually extend that. That means a lot. Now, tell me a little bit about what your expertise is in here at Santa Barbara Family Dentistry.
Okay, basically what I do is family dentistry.
Okay.
I myself take care of all the kids, all restorative work, crown and bridge, cosmetics.
Okay.
Basically family dentistry.
Okay, so a little bit of everything.
Yes.
So if anybody has any kind of general dentistry needs, they can go ahead and give you guys a call, and you may be one of the doctors that helps assist them, right? Okay, perfect. Great. Well, thank you so much. This was very educational. I appreciate it.
Thank you.
In many ways, your mouth is the gatekeeper between the outside world and the rest of your body. Your mouth is teeming with billions of bacteria. There are more bacteria in your mouth right now than there are people on Earth. Over time, these bacteria can stick together and multiply. They form a colony, and the colonies can then join together, forming a thick layer called a plaque biofilm. This can eventually spread across every surface of your entire mouth, your teeth, your gums, your cheeks, and your tongue. Every small space in your mouth provides the perfect environment for bacteria to thrive and for the plaque biofilm to grow, which it can do dramatically over the course of a single day. Your mouth's inflammatory cells are activated to kill the bacteria, but the bacteria can build strong defenses within the colony to stay alive. These inflammatory cells, which are designed to protect the body, can then cause harm in the form of gum inflammation, also known as gingivitis, the earliest stage of gum disease. People with diabetes are even more susceptible to gum disease because their blood vessels are compromised. The area between your teeth and gums is densely packed with intricate blood vessels. Normal everyday activities can burst those tiny vessels. Then pieces of the plaque biofilm and bacteria can detach and mix with the blood, giving bacteria from the surface of your mouth full access to the rest of your body. And for people with severe gum disease, new science suggests that these bacteria may link to other disorders, like heart disease, where bacteria may be involved in plaque buildup in the blood vessels, or pneumonia, where bacteria can create an infection in your lungs, or rheumatoid arthritis, a debilitating disease of inflammation in the joints, or preterm low birth weight in infants, which may be linked to bacteria passed from the mother to her fetus. Good oral care may positively affect your overall health, which is important because what happens in your mouth may not stay in your mouth.
Cosmetic dentistry is an interesting subject because most of the people, they want to smile, and most of the people, they want to have confidence when they are talking to other persons. And a smile is a big part of your life.
The goal of cosmetic dentistry is to turn an average smile into a terrific smile. It's done by analyzing every aspect of a smile and then correcting the problems. Terrific smiles have several things in common. The teeth are straight, not crooked. They're evenly spaced, with no gaps. They're white, not stained. The top teeth show when you smile, but not the gums. The gum line is smooth, not uneven. The edges of the top teeth smoothly follow the curve of the lower lip. There are cosmetic procedures to solve any of these problems. So even if you weren't born with a beautiful smile, you can still have one.
When the pulp of a tooth becomes infected or dies, root canal therapy is necessary to save the tooth. The pulp is a soft tissue made up of nerves and blood vessels. It's contained in the pulp chamber, which extends from the middle of the tooth down through the root canals. It becomes infected when bacteria invades the pulp. This happens most commonly through a deep cavity, which allows bacteria through the enamel and dentin layers and into the tooth. Sometimes the pulp simply dies due to a fracture or a blow to the tooth. You may realize you have an infected tooth because it's sensitive to hot or cold. The tooth hurts with biting or pressure, or there is throbbing, severe tooth pain, swelling, or a bad taste in your mouth. You may also be unaware of the problem because you have no symptoms at all. If left untreated, the infection can travel through the tips of the tooth roots and into the jawbone, where it can dissolve the bone and form a painful abscess. To determine if your tooth has an infected pulp, we'll do a thorough examination, which may include X-rays. The exam sometimes includes checking the health of the pulp with a pulp tester. We may also apply heat or cold, or tap lightly on the tooth to observe sensitivity. Look for changes in the tooth's color, or press gently on the gums next to the tooth to check for pain. If we determine that you have an infected tooth, we'll talk with you about treatment to remove the infection. Root canal therapy is a generally comfortable treatment that can save your tooth and keep your mouth healthy.
Periodontal disease cannot be cured. It can only be controlled. That's why we need to examine you every 3 months. If periodontal disease isn't closely monitored and controlled, it can quickly worsen destroying bone and soft tissue, and this could lead to the loss of a tooth. When we first find periodontal disease, we treat it with scaling and root planing to remove plaque, tartar, and bacteria from beneath your gums. This treatment disrupts the growth of the bacteria, but some remain and settle back into the pocket, where they reproduce. In fact, the number of bacteria doubles every time they reproduce, reaching destructive levels in as few as 90 days. It can be challenging to predict where in your mouth the symptoms of periodontal disease may recur, or when, and frequently it doesn't hurt. The only way to find and control it is with a professional exam that specifically looks for the disease. This also means that a twice-a-year cleaning schedule just isn't safe for those who have periodontal disease. It's important that you come in every 3 months for a periodontal maintenance appointment, which may include taking x-rays, measuring the depth of periodontal pockets, checking for any bleeding or loose teeth, removing plaque above and below the gum line, and talking with you about the effectiveness of your home care. If necessary, we may also retreat with scaling and root planing or apply medication or antimicrobial rinse. Periodontal maintenance visits help us break the stronghold of bacteria in your gums and slow or eliminate their destructive effects.
As you can see, this is our office. Okay. All the apps.
Nice. Very nice.
The doctors working here, patients coming.
Wow, this is amazing.
Yeah, here is the panoramic X-ray machine.
Oh, okay. Tell me a little bit about this.
It's like bigger X-rays when you can see the whole mouth of the patient. You can see all the teeth together.
So then, as far as the X-rays being done where people would set them in the mouth and take the shots, is this accomplishing the same thing, or is this something different?
No, this is your whole mouth in just one picture. And this over here is the sterilization area when we clean all the instruments.
Okay. And
as you can see, Juan is working on it, and this is all the machines that we use to get very clean the instruments.
Well, that's great to know, because obviously sterilization is very important, I'm sure, to many patients. And it looks like you guys definitely have it together when it comes to that, from looking at all the equipment that I'm seeing.
Yeah.
So that's very impressive. Very nice.
We proudly serve the Santa Maria, California and surrounding areas with friendly, professional dental services for your entire family. At Santa Barbara Family Dentistry, you will receive the utmost in service and quality. We listen to you and will walk you through each step of the process of your dental health program. Our friendly staff works hard to ensure you're comfortable and earn your trust. We take your dental health seriously and offer only the most current equipment and dental services, including teeth whitening, breath management, and cosmetic enhancements. Santa Barbara Family Dentistry is here to serve you. Give us a call today and see how we can help you attain the optimal dental health and perfect smile you've always wanted.
Well, this was absolutely amazing. So very educational. I appreciate all your guys' time and meeting every one of you. It was a great experience. Thank you. And your staff is absolutely amazing. Thank you again, Jens, very much.
Thank you. What are we going to say to Valerie?
Healthy teeth and gums for a lifetime.
Thank you.
Bye.